Let's discuss liver fire invading the lung. The liver is anatomically immediately below the lung. This means that if there is liver fire, the fire can rise upwards and invade the lung. This will create heat in the lung and interfere with the lung's descending of qi. In this pattern, there will be symptoms and signs of liver fire, as well as symptoms and signs indicating that the functioning of the lung is disturbed. Foods and beverages that have a hot energy can also create liver fire, including alcohol, fried foods, too much red meat, especially lamb, and spices such as chili and pepper. Chronic emotional imbalances can create liver qi stagnation, which is often a root cause of liver fire. Blood heat can also be an underlying cause because the liver is a reservoir for blood, and the heat from the blood can cause the liver itself to become hot. Symptoms and signs: shortness of breath or difficulty breathing, chest oppression, hypochondriac tension, cough with yellowish or bloody sputum, constipation, bitter taste in the mouth, throbbing headache, dizziness, red eyes, anger, irritability, intense, slightly staring eyes, appears to be stiff or slightly distended in the chest region, spurs, dark urine, red face, quick body movements, burning, urination, thirst, red tongue with even redder sides and red front, dry yellowish tongue coating, rapid and wiry pulse. Key symptoms are cough with yellow sputum, dyspnea, hypochondriac tension, headache, rapid and wiry pulse. Treatment principle: drain liver fire, regulate lung qi. Acupuncture points: choose from liver 2, 14, Ren 17, 22, lung 5, 7, pericardium 6, and LI 11. Needle technique: draining. Liver 2 drains liver fire. Liver 14 and pericardium 6 spread liver qi and regulate qi in the chest. Ren 17 and 22 regulate qi in the upper jaw. Lung 5 drains heat from the lung and regulates lung qi. Lung 7 regulates lung qi. Li 11 drains heat. Because liver fire is the root cause of this imbalance, the person must avoid consuming substances that create heat in the liver. In particular, alcohol, hot spices, fried food, and too much red meat should be avoided. Stress and pent-up emotions, especially anger and frustration, create heat in the liver. A person with liver fire should therefore try to resolve these issues, or if this is not possible, try and reach an acceptance of the situation. Physical exercise is recommended because it will help spread and disperse stagnant liver qi, which is often involved in the creation of liver fire. Liver fire invading the lung can be caused by liver fire, liver qi stagnation heat, and can result in lung phlegm heat, lung yin deficiency, blood stagnation, heart fire. To summarize, etiology for liver fire insulting the lung includes repressed anger and frustration, excessive consumption of hot and greasy foods. Underlying accompanying pathology: liver qi stagnation, lung qi deficiency, spleen qi deficiency. Signs and symptoms: breathlessness, asthma, fullness, stuffiness, scorching pain of chest and hypochondrium, cough, yellow or blood-tinged scant sticky sputum, rashness, impatience, headache, dizziness, red face, thirst, bitter taste, scant dark urine, constipation. Pulse: wiry, slippery, rapid. Tongue: red, redder on sides. Dry yellow fur, swollen in lung area. Treatment principle: clear heat and drain fire. Moisten lung and transform phlegm. Acupuncture treatment: bladder 13 regulates lung qi. Lung 10 disinhibits the throat. Liver 2 clears liver fire. GB 34 soothes vessels. Liver 3 courses the liver. Li 11 clears heat. Liver 14 harmonizes liver qi in the chest. Ren 17 descends lung qi. Ren 22 descends lung qi. Pericardium 6 opens chest, descends lung qi. Lung 7 also descends lung qi. Needle with drainage. Thank you for your attention.